Good afternoon and welcome everyone. Thank you all for joining us for the webinar. My name is Carole Rawson and it is my honor to serve as the chair of the Dystonia Advocacy Network. I am also the Vice President of Public Policy and serve on the board of the Dystonia Medical Research Foundation. The Dystonia Advocacy Network, or the DAN, is comprised of 4 dystonia patient organizations: the Benign Essential Blepharospasm Research Foundation, the Dystonia Medical Research Foundation, the National Spasmodic Torticollis Association, and the National Spasmodic Dysphonia Association. These organizations have worked together for over 15 years to increase awareness of dystonia with members of Congress and their staffs, and to make sure the needs of the dystonia community are addressed. As evident from the recent announcement that dystonia is included on the list of eligible conditions for fiscal year 2022 with the Department of Defense Peer Review Medical Research Program, just goes to show advocacy works. Dystonia advocates made this happen. Thank you all for your efforts this year. We look forward to keeping this momentum going. Everyone was sent materials in advance of this webinar. We hope you have had a chance to review these materials. This webinar will provide an overview of the issues relating to appropriations and what we are asking you to do this month. We will respond to your questions at the end, so please use the chat or questions section to send us your questions, and we will get to as many as we can today. It is my pleasure to introduce Phil Goglas, Managing Partner of the Health and Medicine Council, the firm that has supported dystonia advocacy for over 20 years. Phil?
Thank you, Carole, and good afternoon to everybody who is joining us. It is good to be with many of you. I know that we were hopeful to maybe be in person, but we look forward to hopefully next year getting back to that, where we will all be together back here in Washington, D.C. As Carole mentioned, what I'm going to be doing first is just providing a brief overview of our appropriation issues that we are asking all of you to advocate for, and that is, of course, funding for the National Institutes of Health and for the continued inclusion of dystonia in the Department of Defense's peer-reviewed medical research program. In addition to those, I just want to explain that this year, in terms of our advocacy, in the first quarter, which is now, we're focusing our appropriation issues. Later on this spring, we are going to be addressing access to care issues, and then following up on appropriations that we are working on now as they continue to move through the process. And then we'll follow up at the end of the year as Congress wraps up their legislative items for this Congress and for the year. So for those of you who have participated before, you are very familiar with the importance of our work with appropriations. Just late breaking news within the last hour and a half or so, as Carole mentioned, dystonia is included in the final list of conditions eligible for study through the FY 2022 Department of Defense's Peer Review Medical Research Program, and the President has officially signed the bill, so that is now law. So a big congratulations to all of you who reached out to your members of Congress over the last year and advocated for that continued inclusion. It's a good example of how important it is for all of you to engage in advocacy and the difference that all of you make in engaging with your House and Senate members, advancing our priorities. For the National Institutes of Health, our focus is on increasing overall funding for NIH. And if you watch our video that we recorded earlier this month that all of you will have access to, we go a little more in depth about the role of NIH and the importance and why we advocate for their funding. In addition to the important work that NIH is doing, of course, we know that they handle a lot of research. The other area of research that is critically important, is at the Department of Defense's peer-reviewed medical research program. Where we are now in the calendar, Congress has begun consideration of the fiscal year 2023 process. We know that it took them a very long time to finish off fiscal year 2022. We expect a similar situation here this year. We are in an election year in Washington, and that there's going to be a lot just happening. So we know that appropriations are truly starting off right now. Currently, they're going to be active throughout the year, and it gives us a very good opportunity to first make that contact now make that request for our House and Senate members to push for increased NIH funding, to push for continued inclusion of dystonia in the PRMRP, and then advocate throughout the process this year as they work to finish off these bills, hopefully towards the end of the year on time. We also, as part of our packet that was sent out to everybody, we do have a sample script and email that we hope everybody will be able to follow. We'll talk a little bit more of that in a little bit, but that has all of the information that you will need to talk about the importance of raising the funding level for NIH and for the Department of Defense's peer-reviewed medical research program. So I think Carole and I now will just go over advocacy and what we're going to be doing this year. So Carole, I think you might get us started, or if you want me to get us started, I'm happy to do that too.
If you don't mind, Phil,
Sure.
I'll continue. Thanks.
Sure. So as Carole and I mentioned, there is a prep packet that was sent out to folks that has a in-depth description about and background about everything that we're doing, talks about our advocacy program this year, how we're going to be advocating in 2022, which is a little different than what we have done in the past, and what we're asking all of you to do, and how to contact your senators and your House member. Just a brief review on that is, to contact your senators, we ask you to go to that Senate website, find your senators, and when you go to their website, you look for the area that lists the local offices. We do have an example in there, but you will also see the DC office. We ask you to contact that office that's closest to you. And when you call the office, ask for the person who handles healthcare issues. So that way you're routed to the correct staffer to talk about our key issues. For the House of Representatives, it's very similar. You would go to house.gov, you would put in your zip code, but you might also have to put in your full address because there are some zip codes that overlap across different congressional districts. So you'll just need to verify who exactly it is. We encourage you to follow the same process for the House that you did with the Senate in finding that office that's closest to you, or if you would rather call the DC office, you're more than welcome to do that too. As the country has started to turn the page on COVID, more and more staffers are back full-time in the office here in DC. So we encourage you, if you're more comfortable to do that, to give them a call and ask to speak to the health person. We also are giving everybody the opportunity for the use of whichever platform you find best. If you're most comfortable with calling into your office and reading from the sample call script that we have, if you're more comfortable sending an email to an office, or if you're more comfortable using snail mail and sending a letter to your member of Congress. All of those ways of connecting and contacting your members are critically important, and all of them do make a difference. And I don't want to overlook the fact that over the past 2 years, our community has been incredibly successful in our advocacy efforts. A few years ago, in the midst of the pandemic, dystonia was not included on the draft list of conditions eligible for study. And within a month, our community responded very strongly through engagement with their members of Congress. And by the time the final bill was voted on and passed, dystonia was back in there. And that's because members of Congress heard from all of you in the community. How we got back on the list in FY 2022 is a direct result of all of the advocacy efforts and having each of you contact your member of Congress and raising the importance of it. As always, if there's any help that you need during the process, please do not hesitate to reach out and let us know. You have Janet's email address in there, you have mine as well. We're here to help you throughout the entire process. If you have any questions about the best way to contact somebody, if you're a first-time advocate and you haven't crafted your story before, we're here to help, to talk about how short or long they should be, what you should emphasize. But as always with advocacy, the most important thing you could do is to share your story, share what your experience has been with dystonia from a personal perspective as a patient or a caregiver or a loved one. How has dystonia affected your life? That is what's critically important as you advocate. Many of you have heard my spiel before about how many congressional offices there are and how I could go into each and every one of them and ask them to support our priorities. But what truly makes the difference is hearing from you, the constituents. So I can't stress enough how important your story is to them and how important and the big difference that it does make. I also know, because we've been in a virtual world for officially 2 years now, that there are some hiccups when it comes to using congressional sites. If you run into any of those issues, again, please don't hesitate to reach out and let us know. We're here to help. We are a resource for you. I know that things can be a little tricky when you're trying to figure out the best place to find some information or to submit it. So we encourage you to follow the steps that we've laid out in the packet. But then again, if you have any questions, please give us a call. Again, if you're going to email, we encourage you to use the subject line NIH and Dystonia on the DoD PMRP list. The staffers will understand those acronyms, so you don't have to write everything out. They'll know what you mean. And we ask you to also use that in your correspondence with your phone calls to the offices, or if you're going to write a handwritten letter as well. I do also want to highlight that, I know that some of you experienced this last year, that there may be a little bit of time from when you hear back from the office after you send in your initial correspondence. I know that folks who participated in our virtual advocacy last year, it took them a few weeks, if not months, to hear back from their members that they sent communications to. But I do want to emphasize that even if you send a note in at the end of this month and you don't hear back until the summer or the fall, that correspondence does make a difference. And of course, we've seen that over the past 2 years. I truly understand how frustrating it is that you may not hear back timely, as opposed to when you're on the Hill and we're sitting there with staffers and we're able to get that feedback right away. It's been frustrating for me in the work that I've been doing for the past 2 years too, where I used to be able to be on the Hill every day and step into an office, see somebody, then jump across the hall, see somebody else, or go into another building. And that's been, non-existent over the past 2 years. So I've had to rely on emails and phone calls and know that folks don't always get back to you in a timely manner. So I understand that frustration, but I just encourage everybody to be patient with it. In some cases, there are staffers who, are still either working remotely for whatever reason or in the office a few days. So we just ask everybody to be patient. And if you have any questions on that or any frustration, please reach out and let us know. We're happy to check in with offices on your behalf and be a resource for you as well. We are also this year, in some cases, we are going to be having some meetings with some key members of Congress, depending on the committees that they sit on and how they affect our priorities. So we encourage folks to just be on the lookout, because we may be contacting you to participate in virtual meetings with staff. And if that's the case, we will be reaching out to you to let you know, so that way we can coordinate schedules effectively. But we are encouraging everybody, no matter what, to engage with your member of Congress. Carole, I know I did some rambling there and have gone on a little run. So I'm going to take a quick pause there if I've missed anything, or if there's anything from your perspective that I should be highlighting, or things that people may want to know.
Phil, you did an outstanding job. Thank you. In terms of this year versus the past, in the past, we had Advocacy Day on the Hill. It was an A day. We found that virtual has worked for us over the last 2 years. We're hoping next year we get to go back on the Hill. This year, we're doing it a little differently. Instead of a Dystonia Advocacy Day, we're stretching it over a period of 10 days. So advocacy will take place between March 21st and March 31st. This will help to focus and highlight our requests, which is also why it's important that we all use the same subject line in our emails, so that when offices will see multiple emails coming in with the same subject line, it will have a greater impact. So it is important and helpful for everybody to be on the same page in terms of our subject. And as Phil said, unfortunately, we don't get that immediate feedback that we did when we were visiting with people in the office, and it can take a bit of time to hear back. But what we are asking you is that when you do reach out and you do hear back from your office, please let the Dan know. Email us so that we can keep track of who reached out and what offices responded. That's really important feedback for us to keep track of.
And I just want to highlight that, Carol, because that's critically important for the work that we do here in Washington, to say to an office, if we know that 25 or 30 people reached out to a specific office and haven't heard back yet, it gives me the opportunity to go to that office and say, I know that we've had many constituents reach out on this issue. I just want to elevate it or highlight it for you, so that way you can respond to them. And it also gives us the opportunity, as we look to continue to develop those grassroots connections and the relationship building, that we have a sense here in DC of who's been contacted and who we should be paying a little more attention to cultivate those relationships as we continue throughout all of our advocacy efforts this year.
And we want to thank you all for taking the time to meet with us today and to put in the work and to make Dystonia, to make our legislators more aware of dystonia and the needs of our community, so we could get more funding, to do more research, to hopefully one day find a cure. So thank you all. And I'm going to turn this over now, unless you have something else to add, Phil. I'm going to turn it over to Janet to start with the questions and answers. Are we good?
Yep, I think I've chatted enough, so happy to
Okay, thank you all again.
Thank you, Phil and Carole, for that introduction and overview. We received a number of questions in advance, so we're going to just dive right in. First of all, we received a couple of questions from people about this being recorded. It is being recorded, and the link will be sent out to everybody so that you can review it as well. And in the chat, we put a link to a pre-recorded session on just sort of the overview of the DAN's advocacy program. So for those of you who are experienced advocates, we do the, how a bill becomes a law kind of thing in the House and the Senate. And so that's all in this brief recorded video the link has been sent to you, and we'll email it out to everybody as well. And we've had a couple of comments from people that they did not get their packets, and I'm so sorry. I apologize. Sometimes when we have a number of people on the blind CC, a number of email addresses, your internet provider, your email provider may filter it out. So just email me and I'll be happy to send you the packet as soon as the webinar is over today. So Phil, first question we'll give to you. Can you just review again what the ask is as it relates to NIH? And somebody wants to know, how is that number determined? How does the amount of money that we're asking for appropriation determined?
Sure. So our request for funding for the National Institutes of Health is to increase the funding level to $48.4 billion. And the way we come up with that is we look at the historical increases that NIH has received, which have been around anywhere from 2 to 5%. And we make an educated guess to say where the funding level should be. We know from conversations with different institutes and with the leaderships of the National Institutes of Health that there is a lot of great work that they can be doing. And the only way that they're able to do that is with increased funds. We also know that they were, for many months into this current fiscal year, working with previous levels. So we know it's important to raise that funding level for the National Institutes of Health. And we make sure that the number that we propose is something that is realistic, that Congress has in the past supported. It would be very unrealistic to come in with a request for NIH at $75 billion, for instance. We know that that just wouldn't be possible for Congress. So we work with other organizations in the community to determine what we think is a feasible number that will pass Congress, but also make a critical difference in the work that NIH is doing.
Okay, great. And then the other ask, of course, is to include dystonia on the list.
Into the Department of Defense's list of eligible conditions. And we know that our dystonia researchers have been incredibly successful in competing for funding. We know that a lot of good research has come from it. And we know that because of our continued advocacy work, there are many champions of the dystonia community to ensure that happens. But it's also important for many more members to make that request. And the more that the Committee of Jurisdiction hears from members of the House and the Senate that it's critically important, the more likely it is to be included. And of course, we want to make sure that in every Congress, we are increasing the number of members who are aware of dystonia, and we know that are educated about the important issues facing our community.
Great, thank you. And I should say, I just got an email from one of the researchers who actually received funding through the Department of Defense Peer Review Medical Research Program. And he specifically wanted to give a shout out to all of you and thank you for your efforts. The research that he did is now being used by the Dystonia Coalition and other places. So thank you on his behalf and others. So Carole, you talked a little bit, or maybe Phil did, but who should we, when we go on to email, if we're going to email, what staff person should we direct our comment and our letter to?
So I'll take that one. The person who you should be looking to connect with is the health staffer for your senators or for your House member. And the reason why we want to focus on that health staffer is because they're the one who we want to establish that relationship with as we continue our advocacy efforts throughout the year. There are colleagues of theirs who maybe do more work on the appropriations front or specific defense work, and that staffer will filter our requests to them and make sure to follow up with them. But we want to develop that relationship with the health staffer because there are a number of issues that we're going to be circling back with them on this year. And as we get into the next Congress and forward into the future, developing that one person as your ally and as a champion for us, they then advocate with their colleagues about the importance of our key priorities. And then this way, you don't have to try and filter through 3 or 4 different staffers, depending on how each office is structured. You have one good point of contact that you can utilize. And I know that many of our seasoned advocates who have developed those relationships have found that it is incredibly useful to have that one person you can send a note to and say, that you're checking in about a key issue and know that they'll advocate on your behalf within their office and with their boss.
Okay, great. And if you send an email, can you also then send a letter? Can you do both?
Yep. You can, if you wanted to, you can send an email, you can make a phone call, and you could send a written version as well. There's never a way to communicate with your member of Congress that we oppose. And of course, the more they hear from you, the better. So we fully encourage, if you would like to send all of the above in contacting them, that's incredibly helpful as well.
Great, great. And we've had this question in the past as well, and that is if you go follow the instructions that are sent out in the packet and you go to a member's website, you are entering into like a portal, right? They give you, some of those have space limitations. So what's your advice, your best advice to those folks who, that whole sample email communication may or may not fit into that given the word limitations? So what should we go for there?
Sure. So if you have to cut the sample for any reason, I would make sure that your story is in there and the key points about, please fund the National Institutes of Health at the $48 million level and include dystonia in the Department of Defense's peer review medical research program. But we also encourage you, because those form letters that get filled out, those take a little more time for members and their staffs to reply to. You will get a response, but that will be, in a longer period of time. We encourage you, if you're comfortable, to call the office that's closest to you, let them know that you're an advocate with the Dystonia Advocacy Network and you would like to send the health staffer a note about some key priorities, and and ask for who that person is. So that way you can get their name and email address and send along the information to them. If you're more comfortable speaking over the phone, you can speak to that individual who answered there. Or if you want to send a hard copy of your letter, you can go ahead and do that. But we understand that folks may have different levels of comfort, so we encourage you to do what you're most comfortable with. But do let us know, what platform you used, if you had any feedback, so that way we can follow up on that. But for that, larger contact form, I would encourage folks to use that as probably a last resort, because that's normally what leads to a longer wait time and getting a response back.
We've had a couple of questions. I think they're really good questions about, so are we not writing to Senator Smith? We're writing to the health staffer? I mean, can you talk about sort of the nuance there?
Sure. So it's still to the senator, to the House member, but you're just sharing it with the staffer. The staffer is an expert in the portfolio that they work in. So if you're emailing with the health staffer, they are the expert on staff about health issues, and they're the ones who your senators and House member, seek advice from when it comes to health issues. So while you're sending it to, if you're in Florida, Senator Rubio, the letter may be addressed to him, but you're sending it to his staffer. His staffer will make sure that the senator is aware of that. So you still want to address it to your senators and to your House member, but you'll be sending it and sharing the information via their staffer.
And you've talked a little bit, said a couple of times, the office closest to us. You need to just review that a little bit. I mean, should we not be writing to people in DC? What's the plan there?
Sure. So we encourage you to do both. If you live in a state like Illinois, you may be closer to the Chicago office of one of your senators, or you may be closer to the Springfield office of one of your senators. So it really depends on where you're located in your state. We encourage you to reach out to your local office and to the DC office. I know that it's been very successful for folks to have that relationship with staffers here in DC, that they see them when they come into town, and they have a good correspondence with them via email or phone about any number of the issues that we advocate for, but at the same time have a local relationship as well with those staffers there. So we encourage you to, do both. This year, with it being an election year, members are going to be spending most of their time at home. They're not going to be in DC as much, but the folks in DC and the folks in the local office work hand in hand to advance issues for their bosses. So we ask you to if you can, work with both, but if you're only able to engage with the district office, please know that your requests do make it to the DC office from that staffer.
Yeah. And really what we're looking to do is to develop a relationship with that office, right? The health staffer in that office, and help them get to know us and get to know what dystonia is. And so that when we come around the next time, there's some familiarity, right?
Absolutely.
Yeah, okay. And Carole, to you, when we hear back from our letters or our calls, do you want to does the Dan want to know that?
Yes, it would be helpful for us to know it. And it's also helpful that we know who's reached out, obviously, and to what offices they've reached out to. So yes.
Great, okay.
Thank you.
And then Phil, we had a question about how do you know who the health staffer is?
So that's why we encourage you to give that office a call and say, hi, I'm Phil, and I'm a constituent from Suffolk County, and I would like to know who the health person is, so that way I could send them a note, and the person who answers that phone will be able to provide that information for you. The best way to do that is just to give them a call. I know that folks generally rotate different positions throughout the year, so if there's somebody whose card you have from the last time everybody was here in 2019, we strongly recommend giving a call to the office to see who the person is, because the staffer who you previously worked with may not be on the Hill anymore, or maybe in a different office. So the best way to find out who the health staffer is to go ahead and call the office. let them know who you are and ask for that person's name and contact information so you could share your information with them.
Great. Here's a question we got via email, and we actually have had this a couple of times. When will we be able to make visits on the Hill again?
So it is our hope that that will happen for the larger group, next year in 2023. We have heard a lot of different information here in DC. I haven't been able to be back on the Hill as I normally have been in well over 2 years now. I think the last time I was freely able to move around the Hill was the end of February of 2020. But where we currently are is you can access the Hill, but it's very limited. Just last week I was there, and in order to be able to go into a Senate office, you have to confirm it with the staffer. They have to share your information, and then you have to wait outside a specific entrance. They have to come and meet you outside, escort you through security, escort you through the building to the office, and then after the meeting is over, escort you out of the building. So that way, Capitol Police know that only people who are in the building are allowed to be there. And then on the House side, it's very similar where you have to stand outside a specific entrance. The office who you're meeting with has to send somebody to come meet you outside, escort you through security, and then check you in with the House Sergeant at Arms to make sure that you're on a list of pre-approved people who are supposed to be in the building, and then receive a visitor's tag. And then again, after the meeting is over, be escorted out of the building. And there is a Capitol Police officer standing right outside the little box that you have to take your visitor's tag off and put it right back in. So we aren't there yet. There have been some discussion, and I've seen some news reports that things may start opening up sometime this spring, but it's very hard to gauge exactly what and if and when we're going to get back to that normal of being able to move around freely. So to be on the safer side, we estimate that, as a large group that we normally are, with very strong advocates, probably won't be until calendar year 23. But if that changes, we'll keep everybody in the loop. And I can't tell you that, well, I can say that I'm probably itching more than anybody else to get back on the Hill, because it's just how we were able to get so many things done, to just be able to pop in and to have, quick discussions with folks throughout the day, and be able to, see 10 or 15 people in a span of an hour or so. So I'm itching to get back to the Hill. I'm hoping it's sometime soon. And I know many of you are looking forward to being back in DC, and I look forward to having many of you back here soon. So I guess that was a long way of saying we're making progress, and we're just keeping an eye on what is allowed and what isn't. But hopefully, we'll get back to that soon.
And but people can also go to the district office, right? If they're close and they want to, there's no reason that they couldn't.
Yeah, absolutely. And that all that is based off individual offices. I know that there are some folks who have met locally with their district office, in the past 3 months or so. I know that some district offices probably never really close, if it's similar to how some of the offices on the Hill are. It's just very different across all of the members. So I would just encourage you to, again, make that contact with the district office and see if there is an opportunity to meet in person. You may have a member who has that option. And if they do have that option, I encourage you, if you're comfortable with that, to take advantage of it.
Great. Now we have a couple of people with their hands raised, and I didn't realize that we were going to be able to do this. So Veronica, can you unmute those people? Can we unmute Diane and have her ask her question? No.
I actually hit that by mistake earlier when it started. I actually don't have a question.
Okay, well, that was easy. Thank you. How about Sue? Can we unmute Sue? Sue has a question.
Hi, thank you. First of all, thanks so much for organizing this and sharing everything so clearly. It's super exciting. So I joined a little late, so I'm sorry if I'm asking a question that you answered, but I guess one of my questions was, and maybe it's just my naivete in this area, but is there stuff to do beyond this week? I have dystonia, I happen to be a lawyer. I would love to be more involved in a really proactive way. I'm very excited to do it. And so I was just curious. I love the push for the funding, but I just was curious, is there more that we can do beyond this, 5-day period of a push?
So that's an excellent question, Sue. Thank you for that question. And we have witnesses that you want to be more involved. So we will we will definitely be following up with you. Carole, do you want to talk about the plan this year? Carole and Phil, I mean, this right now is appropriation, but we have plans for other things later on.
Yep. Carole, do you want to start off or you want me to take it?
I would just go for it.
Okay. So Sue, nice to virtually meet you, and I do look forward to your advocacy with us. We have broken up this year into kind of 4 parts as Congress rolls through a midterm election year and kind of what we expect them to be doing. So the first part of our advocacy this year is going to be focused on the appropriations, and that's our request for NIH and DoD. And the reason why we're starting off with that is because this is just the beginning of the process for them when they begin to take input from stakeholders and they begin to draft their bills and to put everything together. So we work very hard on the front end with appropriations to make sure that our priorities are covered. Later this spring, in the second quarter, we're going to be advocating on access to care issues. So that we're going to be talking about some pieces of legislation that are important for our community and raising awareness with other members of Congress who are not appropriators, but are on other relevant committees that have oversight and jurisdiction over advancing some of these critical access issues. We then, in the third quarter, will be following up on appropriations, and that will just trek with where Congress should be in the process in terms of reviewing the bills, marking them up, working them through the final process. And then at the end of the year, because we are in an election year, a lot of stuff won't get happen before November. I know that's very shocking to hear that Congress will not be doing a lot. But at the end of the year, what we'll do is based off of what kind of happens in November, we'll get a sense of what Congress will be doing in the last few months of the year before this Congress ends, and we'll be active on that. So there are going to be plenty of opportunities to engage on advocacy activities beyond just appropriations, but different areas that affect the Dystonia community. And with this again being a hyper local year and the fact that every House member is up for election and a third of the Senate is up, we are strongly encouraging folks to develop those relationships with your members locally. So whether there are town hall events or different events in the community that are happening, we encourage everybody to, as best they can, to start to develop those relationships with the members. So that way, as we work through our advocacy here in DC this year and locally and back here into the new year, we have some of that foundation already set. Janet, I don't know if there is anything else you wanted to add to that.
Yeah, I think so. I would just add that we'll also send out from time to time what we call action alerts or call to action, where we're asking very specifically to take an action. That's part of what we did a couple of years ago in that situation that Phil was talking about when Dystonia was not included on the DoD list, and we were able to, as a community, really rally and contact our legislators and ask them to make sure that we were on, and we were the only disorder then added to that list when it was finalized. So there's that, and I think we'll also, as the summer, we get closer to the summer, send out some potential speaking points. So if you're at the opportunity to see somebody who's running for office, and not just an currently elected official, if you've got candidates, we'd like you to seize that opportunity. If you go to a state fair, almost everybody who's running for office shows up at a state fair, and it's an opportunity for you to very quickly provide that elevator pitch, and you'll get those kinds of speaking points from us.
That's great. I just had one follow-up question. I don't know how relevant it is, but I know I read a lot about, Parkinson and, dystonic tremors via Parkinson's. Do we benefit at all by trying to do something through Parkinson's to help us, since it's such a more well-known condition, and not just being an advocate just for dystonia?
So I'll take a stab at that one, and then Carole and Phil, you guys can correct me. But first of all, from a biomedical research standpoint, anytime there's funding for research, especially in movement disorders and neurological disorders, everybody benefits because it's just more insight into what's happening in the brain, and specifically what's happening as it relates to a movement disorder. We have always thought that educating and raising awareness of our elected officials specifically about what dystonia is can only be helpful to our community. It is different than Parkinson's disease. It is different than tremor. We do work with them. As Phil said, we work as a community, a healthcare community. We do things like decide what the collective ask is for NIH. When it's appropriate, we do join with them on other things. And I think we'll see some of that in the next round of advocacy that we'll have this year, as it relates to access to doctors and access to treatment and those kinds of common things. But when given the opportunity to enlighten someone about what specifically dystonia is, that's really where we want to put our focus, because otherwise it's not going to be done. I mean,
Yeah, no, I'm with you. I was just trying to say, like, can we get a piece of their pie? I wasn't saying at the expense of ours. I was just saying, is there a way that somehow what they get, which might be so much more funding than this condition gets, but part of what they experience is a dystonic tremor, is there some way that when funding is allocated that we get to grab a piece of that? That was my question, I guess.
Yeah, I do think that many researchers, both clinical and what we would call basic researchers, if there's an opportunity to sort of squeeze in and answer a dystonia question, they try to do that.
Okay.
Yeah, I mean, we're really fortunate in that regard that the dystonia research community is really committed to their mission of trying to advance our understanding of what exactly is going on with dystonia.
Okay, thank you. I appreciate it, and I'm excited to work with you all.
We're excited to have you. Welcome.
Thank you.
So I think I think we've hit just about every question that we had. Let me just quickly go through here, and I think we're good. Again, apologies to those who didn't get their packets. You've got a good spam filter and your internet provider, your email provider, which is probably a good thing. So thank you to Phil for the work that you're doing every day to support us as advocates. And thank you to Carole for your leadership. And what Carole didn't say is that Carole also is a person affected by dystonia and has very generously shared her story so that others can better understand what dystonia is. And we appreciate everybody and your willingness to share your personal story. It's a big deal that you're telling strangers exactly what's going on with you. And thank you for your willingness to do that. It really is making a difference. So thank you, everyone. We look forward to another successful year of advocacy. So let's go get them.
Yes.
Yeah. Thank you.
Thanks, everybody.
Bye-bye.
Bye.